All right, hi everybody, it's Dr. Stephanie at Dakota Natural Health Center. We are talking more about thyroid. As you probably have heard already, we have a clinic coming up where we're going to be setting aside an entire day to just do these comprehensive thyroid panels on anybody who's interested. So you don't have to be an established patient, that's fine. We just need to schedule a time and get you here to get the draw completed. So yesterday we talked just really basics about thyroid. Today we're going to go through the different components of this test. That video from yesterday has been viewed like over 1,000 times already, so thanks to everybody who's watched and who's shared and who's commented and asked questions and sent messages. We are more than happy to continue these conversations with you. So today's video is going to be only, maybe mildly comical because you get to experience firsthand why I did not become an artist professionally and instead chose medicine. But we're going to play anyway. We're going to use a whiteboard to talk about some of these different tests. And most of this is kind of on the fly. We haven't spent a whole lot of time rehearsing, so bear with me and let's just see how it goes, okay? So Alicia's gonna zoom in here to my fabulous artwork. And let's just talk about some main components here first. This, if you can't tell by the excellent drawing, is your brain. This is the thyroid gland, our butterfly-shaped gland at the base of the neck. Over here we have the liver, because the liver is kind of important in all of this. And then over here we've got, a cell that represents, sort of our peripheral tissues, or the cells of the body outside of the main endocrine glands. So we're going to start from the top here. The first marker that I'm going to mention is called TSH, or thyroid stimulating hormone. This is the one that's typically tested. So if you have a thyroid blood test done, it's almost definitely going to be TSH. So TSH is thyroid stimulating hormone. It's not actually a thyroid hormone, it's a pituitary or brain hormone. So this is your brain telling your thyroid what to do, okay? So that's what our TSH, essentially, what its function is. So people get confused by this, so I'm just going to spend a second on it. When TSH goes up, that essentially means your brain is turning up the volume to get your thyroid to respond. So high TSH means poor thyroid function. Okay? Okay? On the reverse, if TSH goes down, that means that essentially your brain is trying to quiet down thyroid production, or at least keep it stable. So that's the thing with thyroid. I've had people before say, oh, well, my doctor tested my thyroid and it was great. It was like right at the top of the normal range. And that's where we have to have the conversation where it's like, well, we actually want it sort of middle ground or even a little bit lower in the range, depending on what the range is. Some ranges are a little bit more ridiculous than others, so we try to find that happy medium. Okay, so that's TSH. That's the marker that you're going to see.
Keeps flipping around. Sorry, everybody.
Alicia's the one holding the camera. If you didn't get a chance to see that, is T4. Are we good? Are we good?
It's
Bueller.
like not focused. Okay, there we go. I might have to stand up. Sorry, everybody.
That's okay. Live videos are kind of fun. So T4. T4 is also called thyroxine, and it is an actual thyroid hormone. It's made in the thyroid gland, and it's made by with the help of a couple of different things. So iodine is one, tyrosine is another component, zinc, selenium. There's a few other things that are really important when it comes to producing T4. Yeah, okay, so I'm just going to leave that at that. So T4 is actually produced by the thyroid gland. But it's mostly inactive. It's produced, so we call most of it is bound. So we've got total T4 or bound T4, and then we also have what's called free T4, which is sort of, free to do its jobs. So that's the T4 part, produced in the thyroid gland. Thyroglobulin, or TG, is another component of this test. Thyroglobulin's job is essentially to hold on to iodine. Iodine is kind of toxic, kind of irritating, and again, all things are keep this in perspective. But iodine if there's too much of it in an accessible or a free form that's not bound, it can be irritating or an aggravant to the thyroid. So the body protects the thyroid gland from iodine by using thyroglobulin or TG to hold on to that. So that's sort of the indicator that I've made there. The next part is, okay, so we've got our free T4, and now the free T4 goes, exits the thyroid gland, and it has, to complete the number of jobs that thyroid hormone is meant to do. We do a couple of things. One, T4 is converted to the active thyroid form, which is T3, at the liver and peripheral tissues. So T4 has to travel, and while it's traveling, see, I told you I was going to draw a boat.
I'm sorry, the video or the board's not coming in well. There we go.
Is that good?
Yep.
Okay. So T4 hitches a ride on the boat, and the boat is thyroid binding globulin. So your ability to transport thyroid hormone effectively can be determined or affected by thyroid binding globulin. So thyroid binding globulin transports T4 to the liver. It also transports to peripheral cells, where it can be then converted to T3 and essentially made active. So that's a really good place to probably then draw in our T3, both in the liver. Oh, I should maybe use some different colors. Let's use purple. T3 in the liver, T3 in our peripheral cells. So that's the active form. T3, of course, so essentially all the little things that I'm noting, with the exception of tyrosine and iodine, are components of the test that we're doing. What am I missing? Oh, reverse T3. So reverse T3 is kind of one of those funny markers that we're hearing a little bit about, but don't, generally speaking, you don't see it tested quite often. So when we convert from T4 to T3, it has to happen in a very specific way. If it doesn't happen in that very specific way, T3 is still formed, but it's like backwards. It's like opposite. So while it has some function, it doesn't function nearly as well as T3 itself. And there's different reasons why this can happen. Some autoimmune processes, some medications, some different pathologies can increase, even nutritional deficiencies can increase a person's likelihood of converting from T4 to reverse or ineffective T3 versus the beneficial or the actual T3. So T3, or to make a note that reverse T3 is also tested on this panel. Lastly, the other two parts of the test that we do are going to be for antibodies. Antibodies, of course, are immune system components that the body has created so they're autoantibodies. The body has created these, but unfortunately, there's been some confusion that's occurred, and now your body is creating these immune system markers that are attacking your own tissues. And there are two that are commonly tested when it comes to thyroid issues. If you have either of these, this is when we talk about Hashimoto's or chronic lymphocytic thyroiditis. Two names, same thing. So the two different things that we test for when we're looking at antibodies are, one is called anti-TG, so it's attacking this thyroglobulin within the gland. The other one is called an anti-TPO, and TPO stands for thyroid peroxidase. That is essentially the enzyme that pulls these different pieces of, or the different, the iodine, the tyrosine, the different pieces of creating the thyroid molecule together into T4. So that's an enzyme used within the gland to make the hormone. So you can have antibodies against both of those pieces of this puzzle that then, of course, can cause fluctuations or variations in thyroid function and make it more difficult to stabilize thyroid hormone levels. And it can also help to explain why, if you have fluctuating or unstable thyroid levels, or even if they're fairly normal but you still don't feel good, or you have a lot of thyroid symptoms, that's potentially part of the reason why. So listen, there's always more that we can talk about, but again, our purpose is to try to keep these fairly brief. If you have questions, if something doesn't seem right, if I missed a piece of the puzzle and you'd like more information, post your questions below. And again, we'll do a Q&A session on Friday where we'll try to manage or catch up with a lot of these questions. I hope you found this valuable. One more zoom in on my phenomenal artwork. I'm thinking about seeing if there's any, art studios in town that want to display this.
It's not working.
Oh,
It's like
it doesn't
it
like our whiteboard?
washed it out.
Oh.
I'll take a picture and you can see
Okay.
it.
All right. So we're going to post it later. All right. Thanks for tuning in.